What is chronic systemic inflammation in the body? I'm Dr. Rawat, I'm a physician. Chronic systemic inflammation describes a state of long-term inflammation within the body. It's very important to distinguish this from acute inflammation. Acute inflammation is something which naturally happens in our body. If you get injured, if you have some kind of infection, then you would have a rise in inflammatory cells which are mediated by your immune system within your body. However, this should calm down by itself. If a state of increased immune activation and increased propagation of inflammatory cytokines and inflammatory cells continues within your body, then that's when we call it chronic inflammation. When I do annual physicals on my clients, I often include two blood tests which test for that. One is CRP, C-reactive protein, and the other is ESR, erythrocyte sedimentation rate. A normal CRP would be less than 3 and a normal ESR would be less than 30. Patients who have increased CRP or increased ESR more than once in the absence of a cause such as an ongoing infection or injury have chronic systemic inflammation. Notably, I do not check for inflammatory markers past a certain age. Personally, I have used the age cutoff of 60 because almost all patients above that age would have increased inflammatory markers. Increasing inflammation in the body is a natural part of getting older. And in some ways, reducing inflammation in your body is also a way of beating age, or it is a form of anti-aging strategy as well. Rarely, patients with chronically increased inflammatory markers may have other conditions causing this, such as autoimmune conditions like autoimmune thyroiditis or chronic infections of some kind. So your doctor may ask you some leading questions to check for those kinds of conditions. In most cases, however, there would be lifestyle, dietary modifications required to reduce the amount of inflammation in your body. Persistent chronic systemic inflammation increases the risk of cardiovascular disease, cancer, and autoimmune disease. So it's really important to follow an anti-inflammatory lifestyle